Tumors that exhibit poor antigen presentation and low T cell population are often called as cold tumors. Additionally, T cells in tumor microenvironment can express immunosuppressive checkpoints such as CTLA4 and PD-L1. Blockade of these checkpoints can improve treatment outcomes in cancer patients. In the last decade, immune checkpoint inhibitors have emerged as the first line of treatment for stage 3 and 4 melanoma patients. However, checkpoint blockade achieved 5-year progression-free survival only in 10 to 30% of melanoma patients. Clinical report clearly suggests that patients that have high immune cell population in tumors respond well to immune checkpoint inhibitors and survive longer than the patients that have no immune cells in tumors. The focus of my research was to improve immune cell infiltration into tumors using histotripsy and sensitize the tumors to immune checkpoint blockade. We hypothesized that local treatment of large melanoma tumors with boiling histotripsy and intratumoral anti-CD40 agonistic antibody injection can improve immune cell profile in tumors and sensitize them to checkpoint inhibitors. CD40 receptors are highly expressed on antigen-presenting cells. Agonistic CD40 antibody, upon ligation with CD40 receptors, activates antigen-presenting cells, leading to efficient antigen presentation and generation of T-cell-based antitumor immunity. Systemic administration of CD40 in combination with surgery, radiation, and chemotherapy improved survival in both preclinical and clinical settings. However, systemic delivery of CD40 antibody can result in liver toxicity, and therapeutic outcomes depend on immune cell population in tumors. To test our hypothesis, we treated large and established subcutaneous B16F10 melanoma tumors at a volume of 330 to 400 mm³ with histotripsy and intratumoral injection of CD40 antibody. We treated only 40 to 50% of the tumor core with histotripsy to create a depot of tumor antigen at the tumor core while leaving the peripheral tumor tissue intact to allow infiltration of immune cells into the tumor. The success of histotripsy treatments was monitored in real time using ultrasound imaging and further confirmed by H&E staining, in which a clear demarcation was observed between the treated and untreated tumor regions. Monotherapies were ineffective in controlling the growth of such large tumors. However, combined ST40 treatment achieved a threefold more delay in tumor growth compared to control. This was also evidenced visually in the size of the tumors as shown in the right panel images. Immunohistochemical analysis of tumor sections indicated higher intratumoral CD3 positive T cell population in ST40 cohorts compared to other groups, supporting superior therapeutic efficacy with ST40 treatment. To further evaluate modulation of immunoregulatory genes with different treatments, we performed pan-cancer immune profiling nanostring analysis. ST40 tumors demonstrated dominant upregulation of several immunoregulatory genes compared to control. Specifically, genes associated with macrophages, dendritic cells, T cells, and activated natural killer cells were upregulated in ST40 tumors compared to control. Interestingly, we observed an 18-fold upregulation of CXCL9 along with a 2-fold increase in expression of cell adhesion molecules and co-stimulatory markers in ST40 tumors. CXCL9 is an important chemokine produced by activated myeloid cells and is responsible for T cell homing and positioning in the tumors. We also observed enhanced expression of inflammatory genes such as perforins, granzyme A and B, interferons, and IL-2, indicating improved immunogenicity after ST40 therapy. To our surprise, in addition to these positive modulations, we also found upregulation of CTLA4, PD-L1, PD-1, TIM3, TIGIT, and LAG3 immune checkpoints in ST40 tumors. Based on these observations, as a next step, we primed large melanoma tumors with HD40 therapy and treated the mice with immune checkpoint inhibitors. Combined CTLA4 and PD-L1 blockade therapies, abbreviated as ICI, by itself was ineffective in inhibiting large melanoma tumors, whereas priming of tumors with HD40 therapy sensitized the tumors to ICI and improved survival in mice. To summarize, treatment of large and established melanoma with histotripsy and intratumoral CD40 agonistic antibody activated antigen-presenting cells and increased the frequency and functional status of T cells, thus sensitizing the large tumors to immune checkpoint blockade. I would like to thank my advisor, Dr. Ashish Ranjan, my lab members, and funding agencies. I am grateful to Focused Ultrasound Foundation for providing me this opportunity to present my work.